is a risk assessment required for HIPAA-compliant telehealth platforms. Imagine connecting with your doctor from your living room. It's convenient, but how do we make sure that your health information stays safe? That's where a risk assessment comes into play. When using telehealth platforms that are HIPAA-compliant, a risk assessment is not just recommended, it's required. The HIPAA security rule states that covered entities and their business associates must regularly analyze their systems. This means checking how electronic protected health information is stored, transmitted, and accessed. A risk assessment looks at all parts of the telehealth setup. It checks if the data is encrypted when sent over the internet. It also reviews who can access patient information and whether they have proper login controls. The assessment looks at communication channels used during remote visits to make sure they are secure. For telehealth services like virtual doctor visits, remote patient monitoring, or mental health teletherapy, a risk assessment helps find weak spots. For example, if a platform doesn't encrypt data properly, patient information could be at risk. The assessment also checks if the platform has audit logs that record who accessed what and when. This is important for tracking and responding to potential breaches. Another key part of the assessment is verifying that the platform has a signed business associate agreement. This document confirms that the vendor understands their role in protecting health data. It also ensures they follow HIPAA rules. Different telehealth uses have different risks. A doctor's office might have different security needs than a patient's home setup. That's why the risk assessment should be tailored to each situation and updated if the setup changes. For services like remote monitoring or mental health therapy, the continuous flow of sensitive data makes the risk assessment even more vital. It guarantees that privacy is maintained at every step. Keeping a record of the risk assessment and any fixes made is essential. These documents show compliance during audits and help respond quickly if a breach occurs. When setting up telehealth appointments, providers need to confirm their platform is HIPAA compliant. They should also have a current risk assessment and inform patients about privacy protections and consent. In short, a risk assessment is a fundamental part of HIPAA compliance. It helps ensure that telehealth services are safe, private, and trustworthy. By identifying and fixing vulnerabilities, providers can give patients peace of mind during every virtual visit.